Good morning, good afternoon, good evening, everyone. Welcome. I'm Elizabeth Cousins, President and CEO of the UN Foundation, and I have the honor of moderating today's important discussion on universal health coverage in the context of COVID-19. First, allow me to thank our fellow co-hosts, the governments of Georgia, Japan, and Thailand, on behalf of the group of Friends of Universal Health Coverage, together with the World Health Organization and UHC 2030 for organizing today's important event. Today, we are commemorating last year's high-level meeting on UHC. And this meeting is a call to action to fulfill the promise of quality health coverage for everyone, everywhere. As we gather virtually amidst an unprecedented pandemic, we see all around us the devastating consequences of inequitable access to quality healthcare. Healthcare systems and the societies they serve are struggling under the strain of COVID-19. The pandemic is exposing fractures in our society in the most brutal ways, with the most vulnerable populations suffering the most severe consequences. And against this stark backdrop, the case for UHC is self-evident and it is urgent. The question we're here to ask today isn't why, it's how. How can we learn from this experience and work together to build robust health systems that serve and protect everyone, especially the most vulnerable? Today's eminent speakers will offer lessons they have learned from their vast and varied experiences. And we have two panels. The first will feature national experiences with UHC and COVID-19. The second panel will present UHC from the perspective of civil society and private sectors, demonstrating that delivering on the promise of equitable healthcare does indeed require the whole of society and collective action. And after the second panel concludes, we will try to open the floor for questions and comments, time permitting. And I will be a bit of a taskmaster on time throughout our session. So those who would like to make an intervention or pose a question, when we get to that point, will be invited to use the raise your hand function. Now, before we meet our first panel of distinguished speakers, I want to give the floor first to our co-hosts, the co-chairs of the group of Friends of Universal Health Coverage, starting with the Foreign Minister of Japan. Minister Motegi, we are so honored to have you with us, and I am delighted to hand the floor over to you to start our session.
Elizabeth, thank you so much for your kind introduction. Good morning, good afternoon, and good evening.
Mr. Guterres, Secretary General of the United Nations, Dr. Tedros, DG of the World Health Organization, co-chairs of the group of Friends of UHC. This is the first anniversary of the adoption of the political declaration on the UNGA high-level meeting on UHC, known as the most comprehensive health agreement to date. It is very meaningful that the group of friends and its partners gather together and discuss UHC in the COVID-19 era and towards post-COVID-19 eras. I would like to sincerely welcome yesterday's release of the Secretary General's policy brief on COVID-19 and UHC. In order to tackle the COVID-19 pandemic, it is important to aim at leaving no one's health behind and achieve UHC while taking a stand for the principle of human security. Japan has led the global support quickly and proactively to achieve UHC in the COVID-19 era and towards the post-COVID-19 eras, cooperating with other countries under the current human security crisis. Japan provided foreign aid at an unprecedented speed, having contributed over $1.54 billion to tackle COVID-19 within the first few months of the pandemic since February. There are 3 points that Japan emphasizes in our assistance. First, we will strengthen respective countries' capacity to tackle COVID-19, in particular to research and develop vaccines and other tools and to ensure equitable access to those tools. Japan announced its financial commitment of approximately $300 million to Gavi at the Global Vaccine Summit in June 2020. Today, I announced that Japan will contribute more than $130 million of that commitment to the COVAX Advanced Market Commitment in order to enable lower-income countries to reinforce equitable access to COVID-19 vaccines. In addition, we will advance multilateral cooperation schemes such as ACT Accelerator, and we will also suggest the expansion of access to diagnostics through the Global Fund, as well as the supply of therapeutics through the patent pool.
Second, we must strengthen health systems to prepare for future health crises. For example, in Vietnam, by establishing core medical facilities in cities to tackle infectious diseases, and by forming a network, we helped to strengthen community health systems. In addition, through human resource development, the people who conduct tests and research of infectious diseases, we will be strengthening disease surveillance systems. To do this, sustainable financing and appropriate resource allocation are necessary, and this is essential in achieving UHC. Third, we have to generate an enabling environment to be resilient against infectious diseases, to ensure health security and to improve primary healthcare. Japan will support cross-sectoral programs covering nutrition, water, and sanitation in partnership with the private sector. Currently, as food insecurity increases due to COVID-19, malnutrition and growth stunting are on the rise. Japan is providing support for nutrition improvement in 12 African countries. Toward the 8th Tokyo International Conference for African Development, TICAD 8, to be held in 2022, Japan will be stepping up its effort to realize UHC in Africa. Nutrition is fundamental in supporting UHC. Japan will host the Tokyo Nutrition Growth Summit in the second half of 2021 to enhance global efforts to improve nutrition. Japan overcame the turmoil and poverty following World War II and adopted a nationwide health insurance system, thereby achieving UHC. As a result, we realized economic development, favorable health status, and longevity. In tackling COVID-19, the resilient health system of Japan has proven instrumental. To leave no one's health behind, once again, I would like to emphasize the importance of UHC in the COVID-19 and in the post-COVID-19 era. Japan remains committed to realizing UHC, working hand in hand with the international community.
Thank you very much, Minister Motegi. There's a powerful start to our session, and we're honored to begin this way. I'm delighted now to turn to the Deputy Prime Minister and Foreign Minister of Thailand, Minister Pramudwinai. Your Excellency, please, the floor is yours.
Good day to you all. It's the evening here in Bangkok and certainly in New York in the morning. And elsewhere at different time. Excellencies, the Minister Motegi of Japan, Minister of Foreign Affairs of Georgia, Dr. David Zogalin, and the Director General, Dr. Tedros of the WHO, and certainly our moderator, Ambassador Elizabeth Cousin. Distinguished participants, ladies and gentlemen. It's certainly an honor to welcome you to today's event. I thank Japan and Georgia as co-chair of the group of Friends of the Universal Health Coverage and Global Health and the WHO for co-organizing this event. I also thank the distinguished speakers and panelists for being with us today. Last September in New York, world leaders and the stakeholders gathered at the historic high-level meeting on USC and committed to making USC a reality. Less than a year later, COVID-19 served as a powerful testimony to the value of USC, which has enabled people access to affordable healthcare in a time of greatest need. We in Thailand established USC almost 2 decades ago. We had the firm belief then, as we do now, that USC would contribute to a social safety net that ensure these basic human rights. Today, the pandemic has demonstrated to us that USC contributes not only to health security, but overall social well-being. The UNSG's policy brief on COVID-19 and the USC launch yesterday, the last of the Series 20, emphasized the critical importance of USC in responding to the health emergency and the urgent need to achieve USC. In light of this, the co-chairs will be issuing a joint statement to support this policy. Certainly, we look forward to your support of this statement. I wish to share now 3 lessons on USC in the context of COVID-19 and probably answering the question how, as suggested by Elizabeth Carlson. First, USC and health security are one and the same. Investing in the health system allows us to strengthen and support USC and enhance our emergency preparedness and response to health. Second, people and community actions are key to achieving USC and to an effective response to COVID-19. Our health volunteers were a social innovation rooted in community service. That network enabled aggressive contact tracing, with the volunteers functioning as basic service providers through this unprecedented pandemic. People's engagement leads to community resilience and strong health systems that are crisis ready. And third, we must never cease to promote healthy lives. Health promotion and prevention programs as part of Thailand USC play a very critical role in our COVID-19 response. However, as highlighted in the UNSG's policy brief, both have yet to receive the attention they deserve. Good health and well-being is a gift that keeps giving from generation to generation. Excellencies and colleagues, we must seize this opportunity to make USC a priority. It must not take another pandemic to come to recognize this need. I thank you. Thank you all.
Thank you so much for your comments. I now invite His Excellency, the Foreign Minister of Georgia, Mr. Zalkalyani. Minister Zalkalyani, you have the floor next.
Thank you very much, Ambassador Elizabeth Cousins, Director General, dear colleagues, Excellencies. At the outset, I would like to express my sincere appreciation for my dearest colleagues, His Excellency Motegi and His Excellency Don Pramod Vinay for the timely initiative to convene this meeting, and as a co-host of this event, thank all the participants for joining us today. Dear colleagues, right to health is a fundamental part of human rights. Enjoyment of the highest physical and mental health is essential for building quality lives for everyone. Universal health coverage is crucial for achieving the Sustainable Development Goal, SDG 3, and an important mechanism for eliminating financial barriers to essential services. Unfortunately, we have entered the decade of action to deliver SDGs against the background of a major global crisis that is unlike any in the UN's history. COVID-19 pandemic has threatened to derail 5 years of joint efforts to promote prosperity and to turn back the achieved progress. including in implementation of SDG 3. It has also exposed the need for investment in more resilient public health in the future. In this regard, let me welcome the UN Secretary General's policy brief, COVID-19 and Universal Health Coverage, launched yesterday, which highlights the role of UHC in addressing socioeconomic shocks, in particular those brought upon by the COVID-19. We fully concur with the Secretary General that that in healthcare will have a devastating impact on societies and economies. Excellencies, from the very first days of the spread of COVID-19 in the world, my government has begun to fight in two directions: to save the health and lives of citizens and economy. In the confirmation of the first case of infection in Georgia in February, there has been a constant control over the rate of virus reproduction and other epidemiological parameters, and all measures of the government have been directed accordingly. Everyone, no matter who they are or where they live, have access to the free of charge testing and treatments they need for COVID-19. Today, Georgia is one of the most successful examples in the fight against COVID-19, as evidenced by many international assessments. This success mainly depends on the UHC reform initiated by the government of Georgia in 2013 and implemented with significant support and guidance of the WHO European Regional Office. I would like to highlight that after implementation of the UHC program, service coverage has increased significantly and rapidly from 20.5% of the population in 2010 up to 99.9% by 2014. Dear colleagues, while today we are focused on the global response to COVID-19, we must not forget to deliver on the UHC and fulfill the commitments made in the political declaration of the high-level meeting on UHC a year ago. We believe that universal health coverage is the best way to achieve global development goals and an important mechanism to expand access to high-quality healthcare services, including public health emergency response and improved health outcomes. Thank you very much.
Thank you very much, Minister. And thank you each again to all of you as our government co-hosts for helping to make today's event come to life. But we will mostly appreciate all of your leadership throughout the recent years on UHC, and we will need that support, that leadership as we go ahead into these challenging times. We will now hear a special message from the UN Secretary General Antonio Guterres, who will offer his own views on UHC as a basic human right and as a strategy for mitigating the effects of COVID-19 and preventing future pandemics. So I believe we'll now hear a statement from the Secretary General.
A year ago, I warned that half the world's people were not able to access affordable, high-quality health care. Today, the COVID-19 pandemic has shown that our health systems are inadequate. Weak health systems and unequal access to health care are major reasons why COVID-19 has killed 1 million people and infected more than 30 million around the world. Underinvestment in health is having a devastating impact on societies and economies, undermining progress on all the Sustainable Development Goals. COVID-19 has made the needs for universal health coverage, outlined in the strong political declaration that emerged from last year's meeting, more urgent than ever. Achieving universal health coverage is a major recommendation in our latest policy brief. Other recommendations include strengthening public health measures, coordinating the global response to the pandemic, and protecting other health services during the pandemic, including mental health and sexual and reproductive health programs. We also call for funding for the groundbreaking ACT Accelerated initiative to ensure everyone everywhere has access to future COVID-19 vaccines, tests, and treatment, which should be seen as a global public good. universal health coverage is not only essential to end the pandemic, it will also drive progress across all health-related SDGs, while strengthening the primary health systems that are fundamental to tackling non-communicable diseases. And it is the only way to prepare for future health crises we know will come. I hope today's meeting will build momentum for urgent action to transform policies and systems and deliver health and human security for all. Thank you.
Thank the Secretary General for those compelling remarks and call to action. And now it is my sincere pleasure to introduce Dr. Tedros, Director General of the World Health Organization. Dr. Tedros, the floor is yours.
Thank you so much. Your Excellency, Motegi Toshimitsu, Minister of Foreign Affairs of Japan, Your Excellency Don Pramuduwinai, Deputy Prime Minister and Minister of Foreign Affairs of Thailand, Your Excellency David Zalkliani, Minister of Foreign Affairs of Georgia, Your Excellency Kwaku Agemangmanu, Minister of Health of Ghana, Your Excellency Ambassador Rachel Ao Romamo, Cabinet Secretary for Foreign Affairs of the Republic of Kenya, Honorable Ministers, Excellencies, distinguished guests, dear colleagues and friends. First of all, I would like to thank Japan, Thailand, and Georgia for convening this event, as well as our co-sponsors UHC 2030 and the United Nations Foundation. And I would especially like to thank Japan for its contribution of $130 million to the COVAX Advanced Market Commitments, which will support equitable access to vaccines for lower income countries. Your generosity and solidarity will save lives. Arigato gozaimasu. And I remind all partners that we are currently facing a gap of $34 billion to realize the full potential of the Access to COVID-19 Tools Accelerator. I would also like to use this opportunity to thank former Prime Minister Abe for his visionary leadership on universal health coverage throughout his tenure. I wish him the very best. And during the UHC conferences, actually, I remember him, it's a reminder, because of his really strong leadership and commitment. And I hope Foreign Minister, you will pass my greetings and appreciation for his leadership. And I'm so glad to see the continued leadership of Japan. 1 year ago, the nations of the world came together in solidarity to endorse the political declaration on universal health coverage. The day before that landmark event, the Global Preparedness Monitoring Board launched its first report warning that the world was unprepared for the next pandemic, and that it was only a matter of when, not if, the next pandemic struck. A year on, the COVID-19 pandemic has turned our world upside down. At the policy brief on COVID-19 and universal health coverage says the pandemic has exposed the inequalities and weaknesses of health systems in all countries. Even some of the richest and most powerful nations were caught off guard and unprepared. The pandemic has also exposed the geopolitical fault lines of our world and strained the solidarity that's so badly needed to confront this shared global crisis. COVID-19 puts at risk many of the health gains we have made in the past 20 years. But far from derailing our efforts to achieve universal health coverage, the pandemic must drive us to forge ahead with even more urgency, determination, and innovation. WHO remains completely committed to supporting member states in several ways. Through the UHC partnership, we're supporting 115 countries with planning, governance, health financing, and effective development cooperation. We're supporting countries to invest in core public health functions that are essential for pandemic preparedness, including surveillance, labs, data collection, regulation, and more. Because as the Deputy Prime Minister of Thailand said, preparedness is central. We're giving countries the policy tools they need through the UHC compendium, a repository of more than 300 evidence-based interventions to support the development of benefit packages. We're also supporting platforms for dialogue, including national health assemblies and support for parliamentary networks, providing best practice guidance on how to engage with communities. Again, this is one of the basic tools which is important, the community engagement that, again, the Deputy Prime Minister of Thailand said. We have established the DAO Academy to revolutionize health learning globally and address the expected shortfall of 18 million health workers the world needs by 2030 to achieve the health-related SDGs. We have established the special program on primary health care, providing tailored support to countries to review policies, define essential health packages, and establish institutions that will ensure proper governance. And we have developed a roadmap for engaging the private sector, who are an essential partner in our journey towards health for all. Excellencies, I thank the Secretary General for his leadership at this critical moment and for championing universal health coverage. The policy brief on COVID-19 and universal health coverage is a timely reminder to all nations that investing in health is not an optional extra. It is the foundation of stable, prosperous, and peaceful societies and economies. When we promote and protect health, we also promote and protect jobs, businesses, economies, education, gender equality, peace, sustainability, and more. The COVID-19 pandemic is a crisis unlike anything any one of us have experienced in our lifetimes. But it must also be a turning point for all of us, a catalyst for making universal health coverage a reality, and not just an aspiration. The only way forward is together, working in solidarity for a healthier, safer, and fairer world, as if it was a matter of life and death, because it is. And finally, I would like to thank Ambassador Elizabeth Cousins and the UN Foundation at large for coordinating the Solidarity Fund and for the success of it. And we really appreciate your support, and thank you also for moderating, Elizabeth, this very important event today. I thank you.
Thank you so much, Dr. Tedros, for your stirring remarks, your leadership every single day, and it is an honor to work and support you and your colleagues. Well, the next segment of our program is a distinguished panel of senior government officials from around the world who have kindly given their time to tell us about their own national efforts to implement and sustain UHC amid COVID-19. Some will come to us live, some will be by video. But over the course of this segment, we will hear from, I'm going to introduce them all in a row, and then we'll turn to our first speaker. We will hear from Her Excellency Rachel Omamo, Cabinet Secretary for Foreign Affairs for the Republic of Kenya, Mr. Amadou Ba, Minister of Foreign Affairs for Senegal, Minister Kwaku Agimang Manu, the Minister of Health for Ghana, Minister Daniel Salinas, the Minister of Health for Uruguay, Dr. Minister Harsh Vardhan, the Minister of Health and Family Welfare for India, Minister Jean-Baptiste Lemoyne, France's Minister of State for Tourism, French nationals abroad and the Francophonie. And we will hear from Secretary Wendy Morton, the Parliamentary Undersecretary of State for the Foreign, Commonwealth and Development Office of the United Kingdom, and Ms. Marietta Jaeger, the Deputy Director General for International Cooperation and Development for the European Commission. So a powerhouse lineup from around the world. So without further ado, let me turn the floor immediately to Secretary Omamo from Kenya to start us off. Secretary Omamo.
Thank you very much for this opportunity to join this extremely important conversation on universal healthcare. I want to thank my dear colleague from Japan for facilitating this very important engagement. I wish start off by saying that our country affirms and supports the political declaration of the high-level meeting on universal healthcare. Universal healthcare is an integral part of our government's Big Four agenda as we strive to meet the SDG 3 goal. As a government, we aspire, as we should, to provide our citizenry with access to primary healthcare, and to do so in ways in which they will be able to access such care without financial hardship. We have learned that health shocks are perhaps the biggest cause of poverty and the weakening of family structures in our society. Accordingly, in 2013, we set upon our journey to try and establish a universal healthcare system by abolishing user fees at primary healthcare facility level in order to increase the uptake of these services. Recently, we were able to launch a pilot program in 4 of our counties with a view to expanding health services further. And in this time, we're able to cover 3.2 million Kenyans in a period of 12 months. This pilot scheme is an important tool for learning lessons and identifying best practices before we're able to scale up. Now, the COVID-19 pandemic has been a test for Kenya and our aspiration for universal healthcare. And we have learned that simple things, sanitation, access to water, nutrition, improved living circumstances are critical for universal healthcare. And we have to look at universal healthcare holistically as part of the improvement of the entire social fabric of our societies. We have also learned that COVID-19 exposed gaps, but also strengths in our health system. We were able to learn that we needed more skilled workers, health workers, that we needed better infrastructure, better surveillance and prevention capacities, and the need to leverage digital solutions to expand health access. We also learned that it was necessary that we began to produce our own medicines. We began to produce our own medical equipment, our own treatments, so as to reduce dependency on external suppliers and also to build internal capacity to reduce costs. It is clear that COVID-19 has taught us the lesson of collaboration and solidarity, and we thank the WHO, Africa CDC. We also thank the government of Japan for its very kind financial support and facilities that is extended to Kenya in the provision of universal healthcare. Let us continue to work together to provide these human rights to as many of our people as we can. I thank you.
Thank you so much, Secretary Omamo. We will now turn to a video message from Minister Ba from Senegal.
Excellences, Mesdames, Messieurs les ministres, chers collègues du groupe des Amis de la couverture sanitaire universelle, chers invités et participants, je voudrais à l'entame de mon propos m'incliner devant la mémoire du million de victimes de la COVID-19 et souhaiter un prompt rétablissement aux millions de malades. À l'ensemble des acteurs mobilisés contre cette menace collective, en particulier le personnel de santé, j'exprime mes vifs encouragements. Permettez-moi ensuite de remercier particulièrement le gouvernement japonais pour l'organisation de cette réunion qui illustre son leadership remarquable dans le cadre de la promotion de l'accès universel à la santé. Mesdames et messieurs, la pandémie en cours et ses effets dévastateurs sur tous les pans de notre vie a fini de démontrer, si besoin en était encore, notre vulnérabilité collective. Face à cette prise de conscience, la solidarité et la coopération internationale sont devenues sûrement l'unique alternative pour une prise en charge effective des enjeux globaux, en particulier en matière de santé et de situation d'urgence. Sur ce point, je rends un hommage appuyé aux organisations internationales, notamment à l'Organisation mondiale de la santé, chargée d'assurer la coordination de la réponse globale face à cette menace. Dans ce contexte si particulier, Nul besoin de dire qu'un engagement effectif de tous, sans exception, est plus que jamais nécessaire pour la recherche efficace d'un vaccin contre le coronavirus et, le moment venu, son accès équitable, rapide, abordable, sûr, de qualité et à des prix raisonnables. Voilà toute la pertinence du thème qui nous réunit aujourd'hui et qui nous invite à promouvoir la CSU afin de lutter contre cette pandémie. Mesdames et messieurs, comme l'a affirmé son Excellence M. Macky Sall, le président de la République, à plusieurs reprises, le Sénégal est résolument engagé en faveur de l'accessibilité de tout traitement contre la COVID-19, en particulier d'un éventuel vaccin, en tant que bien public mondial. C'est pourquoi notre pays soutient les initiatives multilatérales telles que Access to COVID-19 Tools, COVID-19 Tools Accelerator, l'essai clinique Solidarity ou encore le groupement d'accès aux technologies contre la COVID-19. Conscient de l'importance de mener ce plaidoyer pour la prise en charge des questions de santé publique au sein des instances internationales de discussion et de décision, notre pays se félicite également de la contribution positive du groupe des Amis de la couverture sanitaire universelle en la matière. En effet, à travers ce groupe, nous disposons d'un cadre de réflexion propice à un partage d'expériences, d'initiatives et de bonnes pratiques qui permettra d'identifier les voies et moyens de parvenir à la mise en place effective d'une couverture santé universelle d'ici 2030, indispensable à la réalisation d'un développement réellement durable. Mesdames et messieurs, dans cet ordre d'idées, permettez-moi de partager quelques éléments d'information sur les efforts du Sénégal, y compris dans le cadre de la mise en œuvre du plan national de riposte contre la COVID-19. Ces efforts s'inscrivent dans la continuité du premier plan d'action prioritaire 2014-2018, qui a favorisé le lancement en mai 2014 de la couverture maladie universelle sur instruction du chef de l'État. La CMU bénéficie aujourd'hui à environ 3 millions de personnes, prend en compte les mutuelles de santé, 675 mutuelles installées dans 675 communes, en plus d'assurer la gratuité de soins à près de 2 millions d'individus, dont les enfants de moins de 5 ans et les personnes âgées de 60 ans et plus. Cette couverture devrait être renforcée dans le cadre du plan d'action prioritaire 2019-2023 du plan Sénégal émergent, qui prévoit un accroissement des investissements dans le secteur de la santé en vue de renforcer notre souveraineté pharmaceutique et sanitaire. Par ailleurs, la mise en œuvre du programme national de vaccination qui couvre 13 maladies, notamment grâce au partenariat avec le Gavi, a contribué à réduire considérablement la mortalité infanto-juvénile. En outre, dans le cadre de la lutte contre la pandémie en cours, notre pays, qui dispose d'institutions de référence et de ressources humaines de qualité allouées à travers l'Institut Pasteur et l'appui du gouvernement britannique, un partenariat avec la firme Mologic pour la production de kits de tests rapides de la COVID-19 à un coût abordable dans le cadre de l'initiative Diatropix. Mesdames et messieurs, pour terminer, je renouvelle l'appel du Sénégal visant à rendre accessible à tous les pays tout vaccin ou traitement mis au point dans le cadre de la lutte contre la COVID-19. C'est ainsi que nous pourrons collectivement vaincre la pandémie. Pour sa part, au-delà des efforts pour venir à bout de cette pandémie, ce groupe devra poursuivre son plaidoyer en faveur de la disponibilité et de l'accès aux services essentiels de santé, en particulier aux soins primaires de qualité, indispensables à la réalisation de l'agenda 2030, en particulier de l'ODD 3, afin que personne ne soit laissé en rade. Vous pouvez, chers collègues, compter sur la disponibilité du Sénégal à continuer d'œuvrer dans ce sens. Je vous remercie de votre attention.
Thank you very much, Minister Ba. And a reminder to everyone listening, there is an interpretation button at the bottom of your screen if you need to turn on interpretation. Just remember to turn it off when you no longer need it. We'll now go next to His Excellency Kwaku Agyeman-Manu, the Minister of Health for Ghana. Minister, over to you.
Thank you very much, Ambassador. The Secretary General of the UN, Dr. Guterres, Director General of the WHO, the Secretary Director of the UNICEF, CEO of Gavi, colleague ministers, I wish to congratulate you for organizing this meeting under such unprecedented times. The UN high-level meeting on universal health coverage held last year was a major opportunity to mobilize the highest political support for UHC as the cornerstone for achieving SDG 3 and delivering successful outcomes for other health-related initiatives. Ghana has prioritized the achievement of UHC as an important national agenda as part of our social contract. The development of our national UHC roadmap is indeed a symbol of our ownership toward UHC. In this UHC roadmap, we define what UHC actually means so that we are clear about our goals and our milestones. We have a national UHC definition that articulates where our goal is to ensure all people in Ghana have timely access to high quality health services, irrespective of ability to pay at the point of use. With this, we share a common vision of the UHC, and all efforts in the health sector will contribute to reach this goal. Our priorities to achieve this national UHC goal is to increase the National Health Insurance Scheme coverage to 100%, and we will reach people with comprehensive UHC package of care, interventions, and services. While CHIPS will remain as the closest health facilities for the people of Ghana, clinical care at health centers will be reinforced. We also foresee greater roles played by private sector in the provision of quality care, while their services can be purchased by the National Health Insurance Scheme. While Ghana continues to make progress in service provision, Ghana, like any other country in the world, has not been spared by the COVID-19 pandemic. Since Ghana recorded its index case on March 12, 2020, a total of 46,387 cases have been confirmed, with a cumulative number of recoveries at 45,942 as at end September 2020, with 413 active cases. The response to the COVID-19 outbreak has led to disruptions in the provision of essential health services. We have seen drops in our immunization coverage for children vaccinated with Penta-3 and also measles rubella in 2020 compared to similar months in 2019. However, our antenatal care registrants and deliveries has not changed much. COVID-19 has also exposed inequities in our human resources and adequate infrastructure for service delivery. As a result, government has recruited about 90,000 health personnel between 2017 and 2020, and also announced a major infrastructure drive we call Agenda 111 to ensure each district in the country is provided with a hospital. We continue to strive for better quality of care. We have tremendous challenges ahead of us in financing UHC as we move to middle income economy and transition from external support from international donors. We are restructuring our National Health Insurance Scheme to enable it to offer the Ghanaian financial risk protection. We have improved on our membership with the deployment of mobile renewals. About 80% of our renewals is now done with mobile money transfers. The NHS active membership has improved from 19.5 million in the population in 2018 to 22.6 million by June 2020. Last but not the least, we also need to accelerate our efforts to leave no one behind in health service delivery. Use of technology and innovation to reach the hard-to-reach will also be accelerated. Area logistics supplies using drone technology are helping the health system supply medical products to hard-to-reach centers much faster and easier. Electronic patient record management system is being deployed through the National e-Health Project. More domestic financing for health will be essential to not only keep our service level, but also to expand coverage to achieve UHC. We wish to assure you that Ghana will move the UHC agenda even more forward with our UHC roadmap. We are fully committed to make progress in UHC, and we invite everyone to partner with us on this critical endeavor. I thank you very much.
Thank you very much, Minister, for joining us today and for sharing Ghana's experiences with UHC in the battle against COVID-19. I now have the pleasure of presenting a video message from His Excellency Dr. Daniel Salinas, the Minister of Health for Uruguay.
Señor Director General de la Organización Mundial de la Salud, señores ministros, señores representantes nacionales, señores participantes, reciban un cordial saludo de la República Oriental del Uruguay. Hoy nos convoca el aniversario de la reunión de alto nivel sobre cobertura sanitaria universal, por lo que agradezco la invitación de participar en tan relevante momento. Y a la vez expresar el honor de exponer los desafíos y oportunidades de aplicación de políticas nacionales y buenas prácticas en el contexto de la situación generada por la infección de COVID-19. Queremos decir que en este sentido nos hemos basado fundamentalmente en una actuación multi o transdisciplinaria de todos los ministerios y de todas las fuerzas vivas de nuestro país, y basamos nuestra estrategia en un testeo precoz y masivo, con un desarrollo de un kit nacional producido por nuestros científicos en PCR en tiempo real, y esto ha determinado que al momento actual llevemos prácticamente 250.000 test, que para la población de nuestro país significa haber testeado al 7% de la población nacional. El rastreo y el equipo de seguimiento es fundamental también desde nuestra división de epidemiología y con una división territorial en todos los departamentos de nuestro país, teniendo un equipo de más de 100 personas que hacen actualmente rastreo y seguimiento para poder realizar un diagnóstico precoz y un aislamiento preventivo. Luego, los que están enfermos continúan con ese aislamiento hasta cumplir todo su periodo de estado. Hemos trabajado además en la innovación en nuevos sistemas de diagnóstico de biología molecular, como el bucle isotérmico o sistema LAMP, que está pronto a lanzarse. Se ha mantenido una comunicación fiel y diaria de la situación. Se ha realizado una campaña a través del Plan Coronavirus, una campaña de bien público de comunicación. Se hizo una gestión de la vacunación en forma estratificada para la vacuna antigripal y se duplicó la cantidad de vacunas en respecto a los 5 años anteriores, pasando a 1 millón de dosis para una población de 3.450.000 habitantes. Se realizó una tarea de vocería y de capacitación a los periodistas y se dio transparencia y cristalinidad a la información, que creo que han sido puntos altos para lograr la credibilidad y la conciencia de la población. Se declaró la emergencia sanitaria, se racionalizó el uso de los medios disponibles, se realizó telemedicina, se procuró a su vez que los médicos se trasladaran a los hogares en lugar de las personas trasladarse a los hospitales. Enviamos médicos a todos los domicilios, hicimos el seguimiento en domicilio, el hisopado en domicilio y el tratamiento en domicilio. Normalmente, prácticamente 9 de cada 10 recibieron tratamiento ambulatorio y solamente entre 2 a 3 de cada 100 requirieron internados en cuidados intensivos. El aislamiento social y voluntario en todo momento, la suspensión transitoria de las clases en todos los niveles por 2 meses y luego la reapertura global, la reapertura progresiva, mejor dicho, con protocolos para cada uno de los sectores de actividad fue fundamental. En este sentido, convocamos un grupo de expertos que estuvieron trabajando desde el primer momento junto a nosotros para asesorarnos en las mejores prácticas. Y en este sentido, he de destacar que incorporamos rápidamente como elementos precoces al diagnóstico la anosmia y la geusia, fuimos de los primeros, y el uso de tapabocas masivo y distanciamiento físico-social. Generamos un mapa sanitario, teníamos en tiempo real cuál es la disposición de camas y camas libres de CTI. Hicimos una prevención de efectos psicosociales a través de las líneas telefónicas de atención gratuita, con decenas de miles de llamadas, con equipos de expertos en psicólogos para atender el tema de la soledad, la ansiedad y la depresión. Capacitamos recursos humanos, tanto médicos como de enfermería, realizando upgrade en sus capacidades. Se hizo una interfase de cuáles capacidades podían ser solapadas y actuamos en los establecimientos de larga estancia, como los residenciales de ancianos, en las cárceles y en los asentamientos. Nuestra política de testeo ha sido muy agresiva, a tal punto que tenemos que todos los ingresos hospitalarios hoy son testeados. Hemos testeado a más del 75% de todas las personas que residen en residenciales de adultos mayores, así como al personal que los asiste. Y hemos generado una política de frontera segura con un testeo de todas las personas que llegan al país, tanto por frontera fluvial, marítima, aeroportuaria o frontera seca. Incrementamos un 40% de nuestras camas de CTI, pero hoy por hoy tenemos solamente 3 pacientes en CTI, con 1000 camas de CTI de adultos, y hemos hecho importantes acuerdos sin precedentes en la complementación público-privada y adjudicando responsabilidades de seguimiento en los residenciales a las instituciones prestadoras de servicios de salud. Trabajamos en centros de contingencia, centros de convalescencia y centros de corta estadía para pacientes refugiados o trabajadores extranjeros en tránsito, como aquellos que transportan mercaderías en el país. Lo importante de esto es que hemos tenido una recuperación en V de la economía, dada la rápida reinserción laboral y la recuperación del Producto Bruto Interno, con prácticamente todos los sectores funcionando a pleno, excepción hecha del turismo dependiendo del extranjero, en este caso por las razones por todos conocidas de pandemia a nivel mundial. En cambio, todas las actividades productivas e intermedias están en pleno desarrollo y pensamos que vamos a tener una recuperación. No es que pensamos, sino que tenemos ya los datos de recuperaciones de niveles previos a la pandemia en el entorno de un 95%. Muchas gracias y buenos días.
Thank you so much, Minister Salinas, for your remarks. And we will now turn to a recorded message from His Excellency Dr. Harsh Vardhan, the Minister of Health and Family Welfare for India.
In September 2019, the United Nations General Assembly adopted a political declaration on universal health coverage. The political declaration, among its many commitments, stressed the importance of strong primary healthcare systems, increasing investments for health, and effective public health systems. For most of this year, the world has been battling a rapidly evolving pandemic that has spared few countries, testing the resilience of health systems to their utmost. We must applaud the resolve shown by the Committee of Nations in effectively tackling the pandemic and at the same time working to further the aim of universal health coverage. Like several other countries, and as a signatory to the Sustainable Development Goals, India has been working on making universal health coverage a reality for her citizens. With this very resolve, Ayushman Bharat was launched in India in 2018, comprising 2 pillars of health and wellness centers, providing comprehensive primary health care to all, and providing secondary and tertiary inpatient health care to 500 million citizens. However, the COVID-19 pandemic brought home to us several lessons. It has made us realize the importance of resilient and strong public health systems. COVID-19 has also ensured that we now need to focus on accelerating actions related to integration of public health surveillance and data sharing into primary and secondary health care. This has spurred design reforms such as expand and build IT-enabled disease surveillance systems, build capacity for research for One Health, invest in a national digital health ecosystem, strengthening epidemiological intelligence capacity, and create system capacity to meet the need for emergency response. The experience of the past few months has shown the importance of effective state responses through a robust public sector system. Excellencies, I hope this dialogue provides an opportunity to the global community to accelerate and scale up action on health system transformation and better integrate health and financing dialogues for health and human security. Thank you.
Thank you, Minister Vardhan. Next, we will hear from Jean-Baptiste Lemoyne, the Minister of State for Tourism, French Nationals Abroad, and the Francophonie from France.
I don't hear you. I don't hear you.
Can you hear me? I believe others can.
No, I don't hear you.
I'm hearing that there may be some technical difficulties, so I'm waiting to get some guidance. I think most people can hear us. So it may be on your side, and maybe I can ask your colleagues
Elizabeth,
to...
I don't hear you.
Can someone inform our colleague from the mission that I think it's an issue on his side, and we'll proceed with the program, but I want to make sure that we find a way to solve his challenge. So asking our WHO colleagues, please, to reach out if we can solve that quickly so that we can then go to Minister Lemoyne. Mr. Lemoyne, if you are on the line, I believe we are ready for your remarks.
Mesdames et messieurs les ministres, monsieur le directeur général, madame l'ambassadrice, mesdames et messieurs les présidents, il y a tout juste un an se tenait la réunion de haut niveau pour la couverture santé universelle qui a vu l'adoption de la déclaration politique sur ce sujet. Nous ne savions pas alors à quel point nos engagements en faveur de la couverture santé universelle pouvaient être décisifs dans les mois qui suivraient. Et les conséquences sanitaires, sociales, économiques, humaines de la pandémie de Covid-19 sont un rappel que la recherche d'une couverture santé universelle est essentielle pour être mieux préparé à faire face à la prochaine crise sanitaire. Pourtant, avec l'émergence de la Covid-19, nos systèmes de santé ont été et sont toujours durement mis à l'épreuve, y compris dans les pays les plus avancés en matière de couverture santé universelle. Nous avons dû faire face à des services de santé sous tension, voire à saturation. Il a fallu et il faut encore lutter pour que l'accès de toutes et tous aux soins de santé essentiels pour les patients atteints ou non de la Covid ne soit pas remis en cause. Et pour ma part, je tirerai 3 grands enseignements de cette crise pour l'atteinte de l'objectif de couverture santé universelle. 1, le personnel de santé est la pierre angulaire de nos systèmes de santé. S'il n'y a pas un nombre suffisant de médecins, de personnels infirmiers, de sages-femmes, sans un bon niveau de formation, ni une répartition équitable de ces personnels sur le territoire, je le vis dans la ruralité, sans des équipements de protection adéquats, alors il ne peut pas y avoir d'accès pour tous à la santé. Et nous devons, je crois, tous rendre hommage aux personnels de santé qui œuvrent dans tous les pays du monde dans des conditions particulièrement difficiles en ces temps de pandémie. La France s'engage d'ailleurs aux côtés de l'OMS avec la création de l'Académie de Lyon pour un accès élargi à la formation des cadres et personnels de santé. Deuxième enseignement, l'accès équitable aux soins de santé essentiels doit rester une priorité. Même en temps de pandémie, les enfants doivent continuer à être immunisés, les femmes enceintes doivent être accompagnées, les malades doivent être dépistés, suivis. La continuité des services, la prévention à la prise en charge est cruciale pour s'assurer que les progrès réalisés en santé mondiale au cours des dernières décennies ne soient pas perdus. Et dernier point, je souhaite insister sur l'importance de financer collectivement les biens communs pour la santé. Ceux-là même qui fondent les fonctions de base de nos systèmes de santé, la surveillance, la préparation, la recherche, le développement. C'est une première étape sur le chemin vers la couverture santé universelle. Sans elle, on ne peut pas prétendre l'atteinte d'une couverture santé effective. La crise sanitaire nous appelle à confirmer nos engagements vers la couverture santé universelle dans un contexte nouveau où les investissements collectifs dans les piliers du système de santé, dans les fonctions de santé publique seront cruciaux. Et c'est tout le sens du partenariat de la France et de l'Europe avec les pays africains et des efforts faits par la France sur le terrain dans les pays fragiles en réponse à la crise. Et c'est aussi le sens de l'engagement de la France au sein de l'initiative Acte A que nous avons contribué à lancer et qui vise à rendre disponibles et accessibles les produits de santé Covid-19, y compris les diagnostics, les traitements, les vaccins, mais aussi à soutenir spécifiquement les systèmes de santé dans la préparation au déploiement de ces produits. Mesdames et messieurs, sachons tirer les conséquences de cette crise pour ne pas reculer, mais plutôt avancer ensemble vers cet objectif de couverture santé universelle. Le combat continue.
Good fighting words. Thank you to Minister Lemoyne. And a reminder to colleagues, if you are using the interpretation function, you do need to turn it off when you no longer need it because that affects your ability to access audio. Now we will turn to a message from Wendy Morton, the Parliamentary Undersecretary of State for the Foreign, Commonwealth and Development Office of the United Kingdom.
Thank you, Foreign Minister Motegi, and members from Thailand and Georgia for hosting this important event and for their tireless efforts to promote universal health coverage. The pandemic has reminded us that diseases do not respect borders. We have seen it affect access to basic rights and services for the poorest and most vulnerable, especially women and girls, as their education, health, and livelihoods are disrupted and gender-based violence increases. More than half of the countries surveyed by UNICEF have seen immunisations and child health checks disrupted. And this is why universal health coverage is fundamental to a fairer future. Our health is our security, and our security is our prosperity. The key ingredients here are equity, quality, and access. This is the recipe for resilient health services that protect and promote health from young to old, no matter your wealth, gender, religion, or ability, without stigma or discrimination. Our method should bring together interventions that target diseases such as malaria with expanded access to primary healthcare. It should improve access to sexual and reproductive rights and health services. And it should promote better health by preventing and treating malnutrition and ensuring access to clean water, adequate sanitation, and basic hygiene. But none of this is possible without systems that have public health built into their DNA. Health systems that give people access to quality healthcare without being pushed into poverty, that protect and reach the most marginalised and vulnerable. A year ago, we stood together at the UN high-level meeting on universal health coverage. We declared our commitment to achieve better health and well-being for all. We could not have known then how that mission would become even more urgent or face such enormous challenges in 2020. The UK remains absolutely committed to universal health coverage. Our programmes with partner countries have supported them to invest in health systems, to be better prepared for the pandemic and more adaptable to keep essential services going. Our Prime Minister, Boris Johnson, has announced a new £340 million investment into the World Health Organization. We believe that a strong, effective and united WHO is vital to achieve this vision. And we continue to be a leading contributor to global health initiatives, such as Gavi, the Global Fund and the Global Financing Facility. We are confident that this will deliver results, save lives and strengthen systems that build universal health coverage. But let me end on a call for all our friends and our partners. We must rally our efforts for resilient health systems that are accessible to all, regardless of means. This will be fundamental to our ability to take on pandemics and other threats like antimicrobial resistance and the effects of climate change. It will be fundamental to ending the preventable deaths of mothers, newborns and children from poor quality of care, diseases like malaria and lack of access to the services that they need. It will be fundamental to delivering Global Sustainable Development Goal number 3, with universal health coverage at its heart.
Thank you very much, Undersecretary Morton, for those remarks. And last, but certainly not least for this segment, it is my pleasure to welcome live the Deputy Director General for International Cooperation and Development for the European Commission, Marietta Jaeger. Thank you for joining us. Marietta, the floor is yours.
Thank you very much. Honorable Ministers, Excellencies, colleagues, it's an enormous pleasure and honor to address you today at this important ministerial meeting on universal health coverage. I would like to excuse my commissioner. She would love to be with us, but unfortunately she asked me to participate. Let me first of all congratulate the organizers for this timely meeting, 1 year after the high-level meeting and endorsement of the political declaration on universal health coverage. We must continue to monitor closely the progress being made and identify any setbacks, especially in a time of pandemic. With over 35 million cases and more than 1 million fatalities worldwide, all the countries have been affected, and it has touched us all. And COVID-19 has also put at risk a lot of the progress we have made in international development programs and the health programs. And the programs towards universal health coverage has clearly suffered a severe setback on a global scale. And we need to bring it back as a matter of priority. That is my first message. Today's situation reinforces what we have already known for a long time. In the face of the pandemic, UHC is the best way to secure the health of all individuals, and especially the health of the most vulnerable population. It's also clear that we need to have a very robust, sufficiently robust health system in order to prevent any major outbreak. And the preparedness here is crucial. My last point is that financing and investment in health is extremely important, and we need to work together to increase it. My last message is on the urgency of working together to address this global challenge. To move in this direction, we, EU and the member states, have taken a global response to COVID-19 crisis as a Team Europe to support partner countries, and global problems need global solution. For this purpose, we collected 36 million in order to help our partner countries. Also, the EU has led the efforts to develop and having access to vaccines at the global stage. And we had the pleasure and honor to participate at all the pledging conference from the 5th of May on, and to participate in ACTA and also now in the COVAX facility. And we have a full commitment to continue to do so. Let me conclude on a more positive note. There has been a progress. I have witnessed it firsthand. I had the pleasure to be in Tokyo on the UHC Day in 2017. At that time, the partnership benefited from 28 million grants supporting health system in 28 countries. Since then, I have seen that the partnership matured and grow to now to bring 115 countries under its umbrella. And our commitment to health system strengthening by working under the partnership is reflected also in almost 150 million we are currently providing to the WHO for the health strengthening for the period of 2019 to 22. Honorable ministers, colleagues, we need to combine our efforts to respond globally to the COVID-19 pandemics and continue to handle this pandemic with the extreme care, responsibility, and unity. And first milestone for that is universal health system. Thank you very much.
Thank you very much, Deputy Director General. And thanks again to each of our esteemed panelists. That was a powerful segment. And we thank you for sharing your experiences and your reflections on the vital need for UHC in the fight against COVID-19 and all the other health goals we have for our societies and communities. We will now move into our next section of the agenda and hear from a diverse range of UHC champions. And we want to start with reflections from the Executive Director of UNICEF, Henrietta Fore. As an agency devoted to the health and well-being of children everywhere, UNICEF has long been a steadfast proponent of UHC. And ED Fore will offer some thoughts about the role of UHC in helping safeguard children's physical, mental, and developmental health during a pandemic. ED Fore, over to you.
On behalf of your friends and partners at UNICEF, we thank the group of friends and our host from the Japanese mission for bringing us together to talk about such an important issue. At UNICEF, we recognize that universal health coverage and fully accessible public health systems are fundamental. They are fundamental to the health of children and their families, to the social and economic development of communities and countries, and to the global progress envisioned by the Sustainable Development Goals. Without universal access to quality healthcare for all people, any vision of a truly equal society will remain unrealized. COVID-19 exposed the lingering weaknesses in the public health systems around the world between people who have access to healthcare and those who do not. But even before the pandemic, the world was off track in meeting the Sustainable Development Goals on health. As we look to respond, recover, and reimagine health systems to control COVID-19 and build stronger systems for the future, we must redouble our commitment to universal health coverage. First, this means strengthening primary healthcare systems and bringing them closer to where people live. Immunization, treatment, and the prevention of diseases like malaria, diarrhea, pneumonia, malnutrition, all basic child and maternal care. These services should be accessible and affordable to all people, no matter where they live. Second, we must develop and deploy innovative tools and treatments to address future pandemics. UNICEF is supporting the ACT Accelerator initiative to develop and deploy innovative new vaccines, diagnostics, treatment tools like oxygen therapies. And we're proud to be playing a lead role in the COVAX facility to ensure that any COVID vaccine is delivered fairly and equitably around the world. This could become one of the largest procurements of vaccines in history, and we look forward to working with the public and private sectors to manage the supply chains for these vital vaccines. And third, universal health coverage demands that we strengthen all of the systems that support people's health. Education systems that help every child to develop and grow. Food systems that supply nutritious food affordably and in communities where people live. Water, sanitation, and hygiene systems that can support communities and health facilities alike to prevent disease. Systems that support mental health, including counseling and psychosocial support for children and adolescents. And social protection systems that can help families make ends meet and support good health. By working and investing together, we can help ensure that all people, no matter who they are or where they live, have access to good quality and affordable health care. Throughout all of this work, UNICEF is proud to be working with all of you to make universal health coverage not just an ambitious dream, but an achievable reality for every community and every child. Thank you.
Thank you, Henrietta. That was a terrific start to our next segment of this morning or afternoon. And I want to introduce you to our second panel of UHC champions, each of whom has a unique perspective on the imperative for universal health coverage. I'll introduce them rapidly in turn. We are running late in our program. We may go over 5 to 10 minutes, but it's a powerful next group of speakers we have, so eager to get to them. Well, we'll be speaking with Seth Berkley, the CEO of Gavi, the Vaccine Alliance, Richard Hatchett, the CEO of the Coalition for Epidemic Preparedness Innovations, or CEPI, Silvana Sinha, the CEO of Prava Health, and Kwat Tihi Wen, the Executive Director of the Center for Support Community Development Initiatives and a member of the UHC 2030 Advisory Group. And I'll ask them each a couple of very short questions. We'll get some short answers and we'll see where we are on timing and to determine whether we have time for a couple of questions for them. Seth, I would like to start with you. You know, the world has made tremendous gains in health over the last generation, yet we are seeing a resurgence in infectious disease, many of which are easily preventable. How can UHC sustain and bolster the gains we've already made in health and well-being?
So thanks so much, Elizabeth, and what an amazing set of panelists we've had up until now. I have to start with expressing my sincerest appreciation for Minister Motegi's announcement of Japan's $130 million contribution to the AMC. And I also want to thank Japan to be the first country to confirm its participation in the COVAX facility. Given their leadership as a flag bearer of UHC and leader in global health, it has sent a signal to the rest of the world. Getting to your question, I think the critical issue right now for us is to minimize the disruption caused by COVID-19, and from our perspective, obviously, restoring routine immunization and preventive programs if we're ultimately going to have equitable access to COVID-19 vaccines and preventing other disease outbreaks. Why do I bring it up that way? Well, routine immunization programs form the backbone of an inclusive, effective, and efficient primary health care system, which enables these vaccines to reach everyone as quickly as possible, even the poorest countries with the weakest health systems. And what's important is that that is the critical nature for PHC. PHC is the programmatic engine for UHC, as we saw in the 2019 UHC Global Monitoring Report. Of all the interventions in health, immunization is the most widely distributed. About 91% of children receive at least one dose of a routine vaccine. But that last 10%, the so-called zero dose, if they don't have immunization, they don't have anything else. And what we need to do is work with countries to find those families, those communities, and bring them into the health system, because that's where outbreaks will occur. That's where if they do get sick, they will die. And so that's really one of the core pieces of moving forward. We know we can do this. We've been very successful at reaching up until now, but as Henrietta has said a moment ago, there's a massive amount of risk. We've seen in the last 25 weeks, as Bill Gates has said, numbers drop to where they were 25 years ago. 117 million children at risk of measles, many at risk of other diseases. So getting routine back up and ready is critical to where we need to go.
No, thank you so much. So you mentioned the COVAX facility, and I want to ask you a second question about that. It's obviously an innovative mechanism for the equitable distribution of COVID-19 vaccines. Can you say a little bit more about how the COVAX facility can support national efforts to implement UHC?
Well, obviously, the first thing to say is in a pandemic, we're only safe if everyone is safe. That is the critical component we absolutely have to get to everybody, because the idea that a country can get vaccine for itself, vaccinate its citizens, and then everything's fine, that's not true. You won't go back to global tourism, commerce, the ability to travel, the ability to engage. No vaccine's 100% effective, nor does it get to everybody. So we have to be thinking globally for a global pandemic. COVAX facility is trying to do that. We asked the question, normally we work with low-income countries, and we started thinking about that, but working with CEPI, WHO, UNICEF, as you heard, the World Bank, others, we've now put together an effort that can supply the whole world with vaccines, trying to get it to something like 20% of the populations to cover the key risks. So far, we have 170 countries that have joined us with binding commitments. We expect that may get to as high as 190 to 195 countries. And what we're going to try to do there is work to create a large portfolio of vaccines, because we don't yet know which of those are going to work, and then work to get those out as soon as possible with manufacturers who are scaling up their production already, even before they know if they're going to work. So it's a bold new way to look at this. It obviously has implications going forward for global health security, but this is not simple. This will be the largest mobilization for vaccines in history, and we have to solve many problems, including how to rapidly move regulatory, how to deal with, all kinds of issues in terms of supply chain, cold chain, storage, transport, liability and indemnification, et cetera, et cetera. So lots to be done here. It's a time for all hands on deck to work together to make this happen.
Thank you so much. Richard, I want to turn next to you. I mean, you've had extensive experience with vaccine development. And one of the questions is how to entice investors into helping develop the vaccines we need to supply effective health systems writ large. Can you speak to that?
Well, the provision of vaccines obviously is a critical part of providing universal health coverage. And in the context of an epidemic or a pandemic, you can see massive disruption of the provision of routine kinds of healthcare. And we've heard other speakers talking about the damage to how access to other healthcare has been jeopardized for hundreds of millions, even billions of people during the pandemic. CEPI works through public-private partnerships, and we depend on contributions from particularly sovereign donors, but also philanthropic donors to support that work. We have found it during the pandemic, it has actually been a fairly easy sell to the sovereign donors to support the vaccine development work. I think they all understand the critical need, the impact that the pandemic is having, not only on lives, but on economies. We have also found in the public-private partnerships that we have supported a tremendous receptivity to working together in new ways and to working across sectors to develop the vaccines. The global scientific community has come together in an unprecedented fashion, more than 300 vaccines globally in development, 10 of which are now in phase 3 clinical trials. The support that Japan in particular, and I want to thank them both for their support of CEPI's efforts as well as the contribution to the COVAX AMC today, and many other nations have provided for CEPI's R&D efforts in the early weeks and months of the pandemic, allowed us to move very rapidly to build a portfolio of vaccine candidates against COVID-19. We established our first partnerships within 2 weeks, and 8 of the 9 partnerships that we have now have moved into clinical trials, with 3 of those moving into phase 3 clinical trials and hopefully soon to be ready for the world.
Terrific. I want to ask you now about following up also from Seth's earlier comment about the relationship between UHC and health security as really being 2 sides of the same coin, and to say a little bit more about what that means in practice for you and the work of CEPI. But before I go to you, I feel compelled to say this is one of the, excuse me, one of the best chat functions I've seen in a call lately, because just to draw everyone's attention to the commitment from the United Kingdom that they will match £1 for every $4 contributed to the COVAX facility. So that means just in the last hour, a match of £32.5 million to Japan's contribution at the beginning of this call. So the chat is open for anybody who wishes to offer similar contributions, but that's a wonderful piece of news. So Richard, UHC and health security and CEPI.
Sure, on universal healthcare. So at CEPI, first, we believe that access to high quality healthcare when and where it's needed should be an inalienable right for any person. And that gross inequalities in access to healthcare between and within countries is, politically, socially, and economically unacceptable. Universal health coverage is a crucial pillar of global development and a vital avenue through which we can improve health and well-being for all people. And that access is gravely disrupted during pandemics, as we are seeing and as we are beginning to understand in a very painful way. The vaccines that we are developing, obviously, we hope they will be used to end the pandemic, not just to mitigate or temporize, but to end the pandemic and allow that access to a broader health coverage to resume to normal patterns. But if we cannot deliver those vaccines to all the populations that need them, we will not be able to bring the pandemic to an end. And delivering those vaccines is going to require unprecedented levels of collaboration across sectors between governments, private companies, regulators, international organizations, if we are going to provide globally fair access to COVID-19 vaccines, which is both the equitable thing to do, but also the most efficient way to end the pandemic. And that's why, working with Gavi and WHO, we have set up COVAX. And Seth has ably described what COVAX is and what we've achieved just in the course of a few months. I will say that succeeding in our ambitions with COVAX is going to depend heavily on our ability to work across sectors, again, through public-private partnerships, to overcome these barriers to access. If we succeed, it will be the first time that new life-saving medical technology will be delivered to all countries, regardless of their income level, at the same time. And this is a goal we're striving for, obviously, and it will set a critically important precedent for the future. I would argue a milestone in the provision of universal health coverage.
No, thank you. That important point that this is such a strategic innovation, not only for the crisis we're in, but for potential crises to come. So thank you so much for that. And a perfect segue to Silvana. I want to turn to you to talk a bit more about small scale private enterprise and how smaller scale businesses can help countries promote health security and achieve the goal of UHC by 2030.
Thank you so much. It's wonderful to meet you and an honor to be here with all of you today. I'm the founder and CEO of Brava Health, which is an integrated outpatient care model in Bangladesh. So I think that in Bangladesh, we are facing unique challenges. There is not enough testing capacity in the country, nor is there enough acute care capacity. And so we're certainly dealing with the challenges as are many other countries across the globe. And we're trying to learn, and it's been really wonderful to be part of groups like this and the UHC working group that I'm part of to learn how other countries are facing the challenge. I think the private sector has the opportunity to really try to innovate in different ways and to serve our particular communities. And I think there are also opportunities for us to partner with governments to fill in capacity where needed. So for example, when the pandemic first hit, we worked with the government to support testing capacity. Before any private facilities were permitted to do testing, we were filling in excess capacity on behalf of the government. And so I think that there's certainly a need and opportunity for collaboration there. And to be honest with you, I think it's been a great example of something that I hope we can carry forward once the pandemic passes as well. I also think that one of the things that we did as an outpatient care provider when the pandemic first hit, we were approached by UN agencies and other organizations to, explore whether we wanted to build up our ventilator capacity, because Bangladesh only has 500 ventilators for a country of 170 million people. But we were very focused on what we've always been focused on, which is really trying to prevent hospitalizations and keep people out of the hospital. And so we thought about what we could do there. And so we've actually developed a chat-based tool that allows for remote management of COVID positive patients. Nationally in Bangladesh, 51% of patients who are testing positive are having to access hospital care. With our tool, 86% of patients are actually recovering at home. And so in these ways, we're able to innovate and really reduce stress on other parts of the system. Just want to make one last point before I pass it over to you. I know there's a lot of other things to cover, but I do think that in South Asia in particular, 70%, in Bangladesh, 72% of health spending is actually coming from the private sector, and India is about 66%, I believe. And it's been really interesting to observe some inflexibility, to be honest, from the global health community in funding local initiatives on the private sector side of things. And I hope we can at some point look back and reflect on this and really see how the multilateral organizations can better support the private sector to continue to innovate and contribute in the ways that we always have prior to the pandemic, and really need to be on the front lines during it as well.
I really appreciate the point. And I want to ask you a further question about technology in particular. And you described how you were able to innovate an incredible solution in the context of the Bangladesh needs. But can you say more about how we can do more to harness technology to improve the effectiveness and equity of health service delivery?
So I think the equity piece is so important. I think that we need to probably promote more coordination among private and public sector actors, because Bangladesh has been a great example of we talk about vaccinations. I think Bangladesh has really reduced mortality by improving investments in primary care and improving vaccination rates in the last generation. So in order for us as a private sector provider to scale a solution like the one that we've developed, we absolutely need to partner with the public sector on that, because we have 100,000 patients at Brava, but BRAC is serving millions, and there are other organizations in Bangladesh that have much wider scope than we do. And so I think that's definitely one piece, is really promoting the public-private sector partnership. I think beyond that, really promoting a culture of transparency when I think we've all, in our different roles have had to really, hit the ground running as soon as the pandemic hit our countries and the world. And it's very natural even within our organizations for there to be a little bit of chaos. But I think that as we work together with each other, I think we really need to come to the table with openness and try not to think about competing against each other in these different ways, and just trying to innovate together around how we can, prevent deaths and prevent spread of the disease.
Oh, thank you. That's terrific. I want to turn next then to Dr. Quat. Dr. Governments have pledged to implement UHC by 2030. We all know that. But how do we hold them accountable for this promise?
Yeah, good evening here. Good morning, afternoon. First of all, on behalf of civil society and community, I would like to thank Japan, Thailand, and Georgia, and group of friends of UHC for your leadership in UHC, that to make UHC high-level meeting happen last year. And thank you for your continuing leadership to keep UHC agenda alive. And this event is an example, and civil societies appreciate the opportunity to participate in this panel. The government have made the promise, and now how to hold the government accountable. I can share with you a sober reality that we already mentioned last year earlier this year in the Prince Mahidol Award Conference in Thailand. Among all the countries that submit voluntary national review report to the UN from 2016 to 2019, only 8% of the country that use correct UHC survey coverage index or financial protection indicator. So we can see that there's a very little attention at the high level to UHC. That is really pathetic. And when we, civil society engagement mechanism, review the global monitoring report on UHC, we found that even when the country did report on UHC indicator, they failed to identify the people who are left behind. So there's almost no disaggregation by the key dimension of equity, such as gender, age, wealth, ethnicity, disability, geographical location, fragile state, and conflict situation, or the analysis of inequity due to factors that cause marginalization, such as migratory status, sexual orientation, gender identity, identification registration. So, so we can see that the country had left the vulnerable people out from the USC, and they don't pay much attention to USC. So we really hope that the USC high-level meeting and the political declaration last year, 1 year ago, made the difference. So we, so how to hold the government accountable? We have a saying, our side, our might. So if the government is really serious about leave no one behind, they should really keep the most vulnerable in their sight. They should be in the spotlight. The government should make extra efforts to bring the vulnerable population forward. And our side, our mind, if they do care about USC, the USC should be looked at, should be monitored, should be reported to. So the political declaration have promised USC, also promised the protection of the most vulnerable and promote equity and leave no one behind. And we really hope that we can trust our government. So if the government really deserve our trust, the promise need to be delivered. So at the moment, at USC 2030, we are preparing State of USC Commitment Report. So this is this commitment report will get information from different stakeholders, including the voluntary national review report, but also from civil society and from a survey that we collect information from all stakeholders. And you will see whether the government is really serious about fulfilling their promise and how they are doing so in the context of COVID-19. So the report will be launched on the occasion of USC Day this year in December, and we will announce formally very soon. But the theme for USC Day campaign this year has been agreed, and it is health for all, protect everyone. So COVID-19 should not be an excuse to slow down USC progress, but instead COVID-19 is an urgent call to our governments to move faster on USC. And so we will continue to look, to watch, to monitor, and to hold our government accountable by different means and measures.
Making the invisible visible, that's so important. And one further question for you, and you've spoken a bit to this already, but when we talk about accountability and when we talk about UHC in general, we often talk about a whole of society approach. What greater role can individuals and communities play in accelerating this agenda, as you rightly said we need to do?
I think it's because in this panel, we have a lot of government high-level officer. We have the UN participate in here. And in the USC political declaration, we agree about the whole of society approach. Nobody argue about that. Nobody argue about the role of civil society and the community in the USC. But it's not really happen at country level. So we would call upon everyone here, people from the UN, from WHO, from different institutions, Gavi, and the government to really practice what you preach. Do what you say you agree with, engage more with the community, with civil society, with the whole society, by giving us space and putting the funding for us to be engaged. I am so thrilled to see Japan announcement of the funding for COVID vaccine, and then the UK matched the fund. I was like dreaming of the day we have this kind of announcement for the social participation for civil society and community engagement on USC and in health.
Well, if I could just make a quick
follow-up. Very briefly, with an important message, but yes.
Yeah, no, I think the testing point, someone just made a comment and asked a question about testing. I think testing is where we're seeing this very acutely in Bangladesh. You know, I don't think that there's coverage on testing. I mean, we're a private institute, we charge for testing, but even in the government facilities, they're now charging for testing, and that's dramatically reduced the ability for people to access that. And so I completely agree that this needs to be looked at from a global perspective.
No, very fair point. You know, we have just not enough time to have the kind of conversation that we want to continue. There are a tremendous number of questions and comments in the chat. What we're going to do is capture all of those, and they will very much inform the programming of future UHC conversations to come, and where there are specific questions directed to particular panelists, we'll find a way to get a response to some of the questions in the chat, which I fear we just don't have time to have a conversation around given the hour. But this has been a tremendous panel already. I want to thank you all for your time being here, just for everything you each do every day in this fight and in so many related ones to try to improve people's lives around the world and really create that foundation for all the things that our communities strive for. So thank you to you all. And I want to thank everyone today for participating in today's event. I'm particularly grateful to all of our speakers and their willingness to share their time in every time zone, their knowledge and their insights. It is my great pleasure to invite for our closing reflections, Ambassador Ishikani, the permanent representative of the government of Japan to the United Nations, who will conclude today's program for us. Ambassador Ishikani. Hopefully we have you online. There we are.
Hi. Well, good morning, good evening, and good afternoon. Well, thank you, Elizabeth Cousin, for your nice, moderating, and excellencies and distinguished delegates and ladies and gentlemen. Well, I would like to thank the ministers and other high-level, speakers and the speaker from civil society for sharing their views and suggestions on how to tackle this, unprecedented human security crisis caused by COVID-19. I believe today's meeting was instrumental in confirming the relevance of UHC in the COVID context and renewing the commitment of our leaders to the political declaration on UHC that they endorsed a year ago. So, well, in recent months, international efforts to fight COVID-19, such as the ACD accelerator, have shed light on the development of vaccines, diagnostic tools, and treatment. But in addition, we shall not forget the strengthening of health system is a vital pillar in the ACD accelerator framework. And as we have heard repeatedly today, UHC and a resilient and effective health system is one of the most critical factors in combating COVID-19, as well as for preventing future pandemics and minimizing the social and economic impacts. Well, we are encouraged by yesterday's launch of the Secretary General's policy brief on COVID-19 and UHC. And in order to promote the ideas put forward in the policy brief, the co-chairs of the group of friends are now drafting a joint statement. We will present it to you soon and hope as many members as possible will join. Finally, the group of friends of UHC is planning future events, including on the occasion of the UHC Day in December, engaging member states and other stakeholders. This group is open to all member states, and we welcome more countries to join with new ideas and suggestions. Thank you again, and please stay safe and healthy. Thank you very much.
Well, thank you again, Ambassador. Thank you to all of the ambassadorial friends, the ministers from your countries, and all of our distinguished guests, and of course, everybody who joined this conversation. The need is great, the urgency is clear, and from all of the things we have heard today, I think we should take real confidence that there is powerful momentum to act. So thank you all again for joining us. I wish you good health and well-being, and until the next conversation, thank you.